But dermatics is the new thing, really, or the new old thing. It's been around a while. So tell me about IPL, intense pulsed light. I've had that, and it does feel like I've only had 2 treatments, so I think I'm having 3 more before I, you know, lose 10 years. But it's like little snapping rubber bands, really, but they give you a cool thing to hold. Correct. So that when it feels hot, you just hold it there, and it's a little irritating, but it doesn't hurt.
No, it doesn't hurt. It's also called photofacial or photo rejuvenation. So it's basically targeting surface pigmentation. It doesn't get rid of lines or folds. It doesn't tighten the skin, but the skin looks very refreshed and looks rejuvenated, and you know.
Can I get rid of sun damage, brown spots? What about the little vessels?
So the light has an affinity for pigment. So the pigment absorbs the light, and the pigment comes to the surface and then it flakes off. So it's a lunch hour procedure, like therapy. You know, the beauty of therapy is that there is no downtime. You can have the procedure, go back to work the same day.
So no bruising?
There is no bruising, there is no swelling, there is nothing of that sort. And similar to that, IPL does exactly the same thing. So it's a lunch hour procedure, you have the treatment, you can go to work. The pigment flakes off in about 3 to 5 days, and the skin looks just rejuvenated and radiant.
You mean the pigment gets a little darker?
It gets darker, yes.
Splits up?
Because the light has an affinity for the pigment. And so it absorbs it, makes it darker, and then it flakes off.
So if you have a brown spot, a big one or a little one, or a blood vessel or lots of sun damage, it makes you look better. What about the neck? What can you do for that?
You could do IPL for the neck. You could do IPL for the neck as well if you have sun damage. But if you have sagging or lack of elasticity in the neck, then you can do therapy. It has been sort of FDA, Health Canada cleared for a non-surgical neck lift, a non-surgical brow lift, and a non-surgical jowl lift.
Sure, or if you're Diane Keaton, you wear a turtleneck.
That's right.
Or if you're me, you wear a turtleneck to cover up the turkey neck.
That's right. And I'm very excited about it because I'm the only person on the North Shore who's offering this treatment.
Okay, alt therapy. Now Botox, when to go there, when not to, who can, who can't?
So the ideal candidate for Botox, well, you know, there's really no age barrier, but typically the women that I see are between 35 and 60. Although I must say that my oldest client is 86 years young, and it was very interesting. She came to see me a couple of months ago, and because her daughter was getting married, and she wanted to have some Botox and fillers, so I ended up doing a soft lift, and she left the office feeling like $1 million. So, you know, the whole concept of you know, age barriers is really changing quite dramatically in North America.
How long does it last?
It lasts about 3 to 4 months, but studies have shown that if you do it regularly, let's say every 3 to 4 months for about 2 years, you will come every 6 months. So it's more like you know, relaxing the muscles and more like a biofeedback. So over a period of time, either you'll require less Botox or you'll just take longer to come. And
what are the alternatives to Botox? Because I know many, in spite of all the science, many humans are afraid of it because it is starts out as a poison.
It's actually a purified protein of a bacteria, and it's actually injected into the muscles of facial expression. So pretty much anything above the nose to relax and reduce the wrinkles. So the end result is somebody with a very youthful, relaxed, natural looking, a very balanced face. And
still with expression.
Still with expression. So the idea of Botox is not to paralyze somebody, but just to weaken the muscles of facial expression so that you can look more relaxed and more rejuvenated.
Sure. What happens if you get too much? Is that possible? I'm
It
sure
is
it is
possible.
if you have somebody who doesn't know exactly what they're doing.
Yes, and I think it's so important to find a physician who is experienced, who has experience with injecting and is licensed, because there are so many people out there who are just injecting Botox, and it's kind of scary.
Is there downtime?
None.
None.
No pain. You know, when people come and talk to me about Botox, they ask me 3 things. Does it hurt? Does it work? And how much does it cost?
Right. And the cost is up there.
It could be
different
prohibitive
in different places,
yes.
but can you do it on the Never Never plan?
Well, you could.
Pay it off gradually?
Well, you know what, if you think of it, it's equivalent to having a latte a day.
Okay.
Because if you have a latte a day, it's about $5. That's, multiply that by 30 days is $150, multiply that by 3 months is about 500.
Right.
So a typical treatment is anywhere from 250 to 500. You know, it really depends on the choice that you need to make.
Sure.
And
Are there other dermal fillers? I know there are. Other
Yes.
dermal fillers like Restylane or...
Yes. So there's Restylane, there is Juvederm, there is Juvederm Voluma, and they're basically sugar molecules. They're completely natural substances. There's no animal proteins in them, and they're injected into the skin to soften the lines and folds. They're also very hydrating. They can be, they're like a sponge in your skin. So they absorb the water, they hydrate the skin, and they also volumize. So they add volume.
Right, I'm looking at the before after, and you just see that little bit of injecting just brings it up just a bit.
Yes,
softens the line.
It softens the lines, and I think people really need to know about that, because when they come, they expect all the lines to go away, all the folds to go away, and it doesn't. The whole idea again is to soften it. But if you place a filler strategically in certain areas of your face, let's say in your cheeks, or you know, if you define the contours of the jowl or the chin, you can actually give them a very soft and a balanced look, and that's called a soft lift, which is basically using combinations of Botox and Juvederm to give a natural and a relaxed
So
look.
you can mix the two, or you do it differently?
It's just a term that is used to make somebody look more balanced and refreshed and relaxed. So if you place the filler strategically, let's say in the cheeks, to enhance the contours of the cheek, it actually adds volume, because we know that people, the hallmark of aging is volume loss. People look older because they deflate, and fillers basically add volume.
Right, and if God gave you cheekbones,
Yes.
that helps. It seems to hold it up a
That's
little
right.
bit. The profractional laser is a heavier laser?
Yes,
What?
it has much more downtime. It's used primarily for the treatment of scars, acne scars, and deep wrinkles. In my practice, I use it primarily for acne scars. But there is much more downtime with it. So your skin looks like a mess pretty much for a few days, about 3 to 5 days, depending upon, that actually is something called total resurfacing. So it's much more aggressive than profractional, but it's on the same lines in that it's resurfacing the skin, but doing it at a fraction at a time.
And once it's done, it's done?
Once the
profractional laser?
Profractional requires 4 treatments, 1 month apart.
Okay.
And because it's called profractional, because it's, like I said, it's resurfacing the skin a fraction at a time. So yes, the downtime is less, about 3 to 5 days, but you have to come back several times to get the results.
Okay.
The total resurfacing, on the other hand, is for women who have deep wrinkles, a lot of crepiness of the skin, and that's just one treatment. So, but the downtime for that is about 5 to 6 days. And I tell all my patients that you'll hate me for about a week. And you won't want to
get a good book.
That's right.
And you can order in.
Exactly.
Do whatever needs to be done. And I know you can work with unwanted hair on the face, unwanted hair on the lip, all of that too.
That's right.
With what?
Well, we use different types of lasers, and we use IPL for that, as well as lasers for hair removal, depending upon your ethnicity and the type of skin that you have, and all of that.
Okay. High maintenance, we are.
Thank you so much.
Thank you so much.
Thank you.
Dr. Shehla
Ebrahim.
I know. I got it right 20 times.
You did.
Thank you. Ebrahim.